I'm Joe Chille. You can listen to me mornings on the Big Weck. Joining us today on the Big Weck Buffalo on the Rise is Sean Lindstrom from the leadership team from the Veterans Administration of Western New York. Welcome.
Thanks, Joe.
Good to have you here. Tell us a little bit about, when I think about the Veterans Administration, I think about all my friends that were vets. I was of the Vietnam era, and I was high on the list. We did the lottery system then, with that. And so I didn't have to go, but I have a lot of friends that did go. And we talk about it, the Vietnam experience was not quite the experience that we have today, when people return from service, right?
Well, that's true. And being an employee of the Western New York healthcare system, the VA Western New York healthcare system, and a veteran myself, on behalf of the VA, your friends, as you're engaging with them, please continue to welcome them home for us and invite them back. I mean, when I came home from Iraq in 2005, nearly 20 years ago, it was a major, it was a stark difference in terms of how folks were greeted when they came back, and then how they were treated even in the medical center, what the conditions were like, what the expectation of care was the type of services that we can provide. And now, as you know, one of the 5-star CMS ratings, the only medical center in Western New York to receive that rating this summer. It's a place that veterans should be comfortable coming to and know that they're receiving just tremendous care.
And what does the 5-star rating actually mean? Sure.
So rated on a few different metrics, mortality rates, recidivism, readmission rates. One of the things that I'm most proud of, and things that I myself focus in the medical center, is the patient experience. So we've known for a long time at the VA, we can provide effective and efficient care. We can get you the appointment when you need it. The care that you're going to receive is very efficient. And sometimes in the past, you've walked out and been like, maybe that could have gone a little better. I could have been treated a little nicer, whether it's someone at the window or the provider is more engaging. And that patient experience has gone up and up and up in the last several years. We have got a leadership team at the medical center now that, back in the day, well, if you were interacting with Joe on a Monday morning, it might be like, well, that's just how Joe is on a Monday morning. Like, those types
after a Bills loss.
Exactly. those types of things don't fly at the VA Western New York Medical Center, and it shouldn't be accepted anywhere, to be honest with you. But the experience we want the veteran to have each and every time they choose VA is top notch.
So do you do things like, now excuse the name, I'm probably using the wrong nomenclature, but exit interviews with individuals to try to find, where the points are that you can improve?
Oh yeah, we're always looking for those pain points. So many different ways, and myself, we'll send secret shoppers throughout the medical center and sit in a waiting room and see how folks are interacting with veterans as they're waiting for care, what those medical support assistants, are they extending a little bit of extra courtesy as veterans may be a few minutes late to their appointment because they understand maybe just how difficult parking was that day or the weather was adverse or something like that. And then as you're on your way out, like, Joe, tell me a little bit about how things went today. So we're constantly trying to improve.
What about, the veterans that are coming back from service? Like you did, and thank you for your service. We appreciate it. But, I mean, when people come back, are they reticent to contact the Veterans Administration because they just want to kind of separate themselves from the whole experience for a bit?
That's a good point, Joe. I think maybe, initially speaking, that could be the case. I know when I went through a warrior transition program out of the Marine Corps, and someone from the VA came and actually spoke to us, and I could probably remember her voice sounding much like Charlie Brown's teacher. Like I wasn't listening, because all I could focus on was what was next, and I wasn't mature enough at that point to really understand the benefits that were available to me then. So we have to do a better job of continuing to engage with our servicemen and women as they're discharging from the military, ensuring that they know what it is that they've earned.
All right, so how do people, if they're watching this morning, go about getting care?
We want to make it as barrier-free. So whether they're technologically savvy and they could do so on the website, and they can go to va.gov /Western New York. You could always Google many different ways in which you can go about accessing care. You could do so in the medical center. You could do so at our service center, our sister site downtown at VBA if they're looking to apply for benefits. But in terms of care, I personally like that individual face-to-face experience right at our hospital at 3495 Bailey Avenue. And they can meet with some of our experts in the service center that help determine eligibility and enrollment.
And what kind of care they need or what's bothering them
Sure,
or things like
sure.
that, right? What about the PACT Act?
Well, the PACT Act, you know, we're just, I don't know, maybe 15 or 16 months into the PACT Act, and probably the largest expansion of benefits since the GI Bill. We
Wow.
have been very busy over these last 16 months, putting ourselves in front of the veterans in the community and making it, as we said earlier, as barrier-free. So just as we have the main medical center in Buffalo, we have community-based outreach clinics, whether you're located in Niagara Falls or Lockport or Springville, Dunkirk, Jamestown, you name it. We want to be where you are, and we've taken these PACT Act enrollment events throughout Western New York and making it easy for them to get a toxic exposure screen and meet with a provider in their community. And we've seen an increase in enrollments and an increase of veterans accessing that care that they deserve, that they've earned. And they can continue to do so by coming in and visiting us, and they can sign up for that screening.
Okay, 1 minute left.
Sure.
What is their first step? What should they be doing right now as their first step to getting care or questions? Go to your website?
Yeah, go to the website, and I know that you're going to show that on the screen. So go to the website, make a phone call, talk to a veteran that's already engaged with us. We've got a lot of veterans that in the community that might have private health insurance through their employer, and that's great. And you might be happy with your primary care provider that you're receiving somewhere else, but there are other things that we can be assisting you along the way with. So you got to make yourself aware of what those benefits are, and find out by giving us a call.
Sean, thank you very much. For more information and answers to your questions, contact VA Western New York Healthcare by calling 716-834-9200 or go to va.gov/Western New York Healthcare. Sponsorship and promotional considerations for the preceding segment was provided by the following.